Shemai, hello, I'm Eluned Morgan. I am the new Minister for Health and Social Services in the Welsh Government, and it's a huge pleasure to have been asked to participate in your event that's being hosted here in Cardiff for the British Indian Orthopaedic Society. So, croeso mawr I chi, diolch yn fawr I chi am ddod i'r gynhadledd. Thank you very much to the organisers for hosting this event in Cardiff. It's a shame we can't meet each other in person, but hopefully as we see things getting better, hopefully in the next few months and years, we will be able to rectify that in some way. We've all lived through an incredibly challenging time, haven't we? And we've seen really the best of the NHS really show itself during this time. The way people have come together, the way people have learnt to be innovative, and the way people have managed to turn things on really, really quickly in order to protect, in particular, the most vulnerable in our society, has been truly a sight to behold. So thank you to you for your contribution in that. We are absolutely indebted, in particular here in Wales, for the contribution of doctors of Indian origin who make a fantastic contribution to our NHS. Of course, that was born from the inspiration of Aneurin Bevan, a hero to us still here in Wales. Well, COVID is still a huge challenge. It's not over. The Delta variant is still really a huge challenge for us. But of course, even after that challenge will dissipate, hopefully with the incredible success of the vaccine rollout, there are still immense challenges that are facing us, not least in the fields of orthopaedics. And we know, and I'm very aware, that there are literally tens of thousands of people on our waiting lists here in Wales, many suffering in real pain, waiting for their turn. And as the Minister responsible for health, then I'm very aware that it's our responsibility to try and do as much as we can to relieve that pain as fast as possible, knowing the pressure on the system, knowing that we still have to adhere to very strict COVID rules, understanding that there is a limit in terms of staffing and expertise as well. I am particularly privileged to have been asked by Amit and Keshav, who I know are legends here in Wales, and I'm sure they are within your community as well. But I, as the Minister, am absolutely determined not to waste this crisis. This is an opportunity for us to do things differently, to think differently, and to really get a grip. Let's not forget the NHS was born out of war at a time when there were huge debts that had accumulated in the country. And so now is the time for us to do some radical thinking and some real innovation. So I want to make sure we capture that spirit of innovation that we saw emerge so readily during the pandemic. And I'm aware in Wales that we, like everywhere else, need to think about doing things differently. And it's really interesting. I think one of the challenges is to make sure that we bring patients and the public with us. I had a very interesting conversation with a neighbour just a couple of days ago who was just telling me how she'd been waiting a very long time for a knee operation, how much pain she was in, and how she'd been told, well, actually, you know, you need to think about losing a little bit of weight if you want to get the best outcome after an operation. It would be best if you could try and lose some of that weight before. And she was telling me how difficult it was because actually there's a 9-month waiting list in terms of getting to see the dietitian. And I just thought, my gosh, you know, I think we've all got an idea what the dietitian's likely to say. So how do we get people to take far more personal responsibility for their own health? That is a challenge for all of us, and a cultural shift, I think, that we certainly need to embed and certainly something that is absolutely central to our vision within A Healthier Wales, which is a part of our programme within the health service in Wales. I've heard loud and clear the calls for separate planned services when it comes to orthopaedics, with sites away from the pressures of A&E. I have encouraged our health boards here to think in a different way, not to think on a health board footprint, but to think more regionally, perhaps even in a whole nation approach, because we do have to actually address the issue, and centralising services sometimes is the best answer. I was very interested also to see the work that's being done to get patients to understand the risks that they are undertaking when they put their names forward for surgery, and that Consent Plus website is something that certainly is of great interest. I think we've also got to ask difficult questions in terms of productivity. Why are some departments much slower than others? Why are some parts of the country much slower than others? What can we do to get others to catch up? Why is productivity better sometimes in the private sector than the public sector? What is it we need to do to incentivize people to work better, knowing the kind of political position that we take here in Wales as a Labour government? Are we getting too many people referred for surgery? Are we investing enough in alternatives? I was very interested to see, as somebody who spent all day, every day practically on Zoom calls, just getting stiffer and stiffer, and suddenly discovered yoga. And I'm an absolute convert now, and I was very interested to see that that is also a part of your agenda in this conference. So I'm only a few weeks into the job. I know I have a huge amount of to learn, in particular about this sector where I know there will be a huge pressure. I hope that I will be able to depend on people like you to come forward with good ideas, to come forward with suggestions, and we can then learn from each other and hopefully get the best outcomes for the people, certainly who I represent, and so many of your patients. So diolch yn fawr iawn i chi, and I hope you have a very, very successful conference.